So I'm here today to discuss three different things. One would be how important is your role in a setting like this? Another one would be how important is the professionalism and how you should present yourself in a setting like this? And lastly, how important is it to keep yourself healthy, right? So we have to practice what we preach. If someone came in sniffling to take care of me, I would a little be hesitant, right? So for the first part, how important is your role in the office? So in my role here, I transitioned clinically. I managed the pharmacy department, so now I'm able to see patients, and I was doing it alone. So I didn't have medical assistants, I didn't have any technicians, phlebotomists, or anything like that. And I will say it was very, very difficult. Like I had to go in there, grab my own patient, do their own vitals, get their chief complaint, then go back, go over their history, go over everything, and then start my visit. At that point, 30 minutes already went by, and now I'm going to start talking about your issues. The role that you guys play is very important. You kind of give that time back to the provider to where now they can focus on what's actually wrong with the patient instead of getting their blood pressure. And if the blood pressure was taken incorrectly, doing it again. So with your knowledge here of knowing how to do all this stuff, it does save time for the providers. I also consider you guys as like the safety net, right? So the more knowledge that you obtain, listen, and be, curious, right? So research things. If the doctor said something that you weren't familiar with, research it. Because at the end of the day, it's only going to make you better in your role. And sometimes, I'm not perfect. Clinicians aren't perfect. So you can catch them on some things that they might have missed. If I was here to talk about diabetes, and then I realized the patient had chronic kidney disease, but I didn't even mention it, he can go, "Hey doc, hey, you missed this lab. Oh, thank you so much. I'll go ahead and do that." So my medical assistants, it takes training, obviously. And this is something I just recently picked up on with the medical assistant. But there's other things outside of that. So blood glucose checks are very important. Now, with the blood glucose checks, when you get the number, what does the number mean to you? Does it just mean a number? Or does it mean like, okay, this patient is in a diabetic range, or this patient is someone that needs insulin? That's something that you can go to the provider for. So you can provide life-changing treatment for a patient. I've had patients come in with blood sugars about 500, and in those cases, what are we going to do? Just, okay, go on with their visit and send them home? No, in that case, we have to treat it. But you're the first point of contact. You will be there talking to the patient. And when we get into the professionalism, how you present yourself is also a big thing. If you come in there like, "Hi, my name is Dr. Gonzalez, I'm here to take your vitals," like no one's really going to want anyone to do that. Right? They're not going to take you seriously. But being the first point of contact and knowing that information of high blood sugars, low blood sugars, I've had patients come in with blood sugars of like 60. In that case, like, is that bad? Is that good? But you'll let us know, "Hey, doc, this blood pressure or this blood sugar is 60. What can we do?" Okay, we'll give them some glucose. Or high blood pressures. What can we do in those situations? So being the first point of contact, you can tell the doctor a lot of information. And yes, this is more specific to like medical assistants, but in our practice, we also have technicians. So we do in-house testing in our practice to where if I needed someone to go do an EKG, I send them right upstairs. Any abnormal values, they'll come down and immediately and say, "Hey doc, I think you should take a look at this." And we'll read the EKG, and then from there, we can go ahead and take a look at it. But that also comes with training, right? Knowing how to interpret the results and going just beyond what the computer will tell you, right? It can tell you like, "Hey, prolonged QTC," or whatever the case may be. But if you actually look at it and read it, it might be false. There may be other reasons to it. For me, my case as being the medical or the pharmacy specialist, a lot of medications induce these things. So I can just rule these things out 1, 2, or 3. But I can't look at you and tell you that you have an abnormal EKG, right? I need someone to actually hook you up and do all the machine and things like that. We also have in-house phlebotomists that are very useful. There's patients who come in month after month after month without updated blood results. That doesn't tell me anything. If you come and talk to me about your diabetes and the last time you had blood results was in September, pretty much we're wasting each other's time in this situation, right? Because there's not much I can do to you or do for you if you don't have updated blood work. So in these cases, honestly, phlebotomists, I give them credit, I don't like blood, I don't like needles, so that's not my forte. But I understand how difficult it might be to draw blood for patients, and the different ways that you can do it. Either it is from the elbow or from the hand or in other places like that. So that is important to recognize as well. And also the education portion of it. Regardless of what field you're going to be or what role you're going to take in the office, you're always going to be a lifelong learner. I'm still a lifelong learner. Although I went to many years of school, I'm still learning things every single day. The other day, I brought up a patient and he told me he had polycystic kidney disease. Very rarely have I ever heard of that, and I didn't know anything about that. So what I did the next day, I went home and I researched, and now I kind of have an idea for when the patient comes back, how can I treat them? Because he came to me and he's like, I went to nephrologist, I went to urologist, and everyone says that there's nothing you could do. Like, I just want an alternative that we could try. So just taking the time out and researching things you don't know is something that's very important, and also kind of shows character, right? So leading into the professionalism, first appearances are everything. Come in with a smile on your face. I know everyone has their days, not everyone's gonna be happy, but just come in knowing that you could change someone's life. Like the guy that I saw yesterday, I might change his life if I tell him what therapy we can try. And this is just an attempt. It's not even certain it could work, but that's all he really asked for. You're coming in with a smile on your face, you see the blood pressure, the patient has a blood pressure of 180 over 120. Right now, that's in a hypertensive emergency state. But you calm them down. What are you going to do? Tell them like, hey, you're in a possible stroke. You're going to scare the patient, right? So you definitely want to approach it with empathy, with sympathy, because I always try to put myself in other people's shoes. I don't know what's happening in their life. The stress is it raises blood pressure, it raises blood sugar. So just kind of putting them in their shoes. And a lot of patients, especially in the community that we serve, have no transportation, might not have housing issues that are causing these diseases. We call it social determinants of health. And addressing that and being sympathetic to that might be the change that they needed to kind of want to take care of themselves. Professionalism to me starts even before you step into the position that you are. In the classroom here, how you present yourself is mainly how you might carry yourself, because bad habits are hard to break and good habits are hard to start. So if you start the good habits now, by the time you can even get an interview for a position like this, you already have everything set. Some advice I do tell some students, even if you're going to pursue further education, it starts at your interview. You go in, you present yourself nice. Some people I always ask, after your interview, how many of you send thank you emails, right? So that's my one thing. Where I learned during residency, where I had residency interviews, I sent about like 20 to 30 thank you emails just to hear back from like one person, right? So like, it's not like a slap in the face. It does feel bad that like, okay, no one really cares that I said thank you, but it's something that takes.
Wait, yeah. So a thank you email saying thank you for interviewing?
Exactly. So, and it also makes you stand up, right? So you have an interview, you're probably not the only person interviewing for that position, right? So you interview, hey, thank you so much for meeting with me, Dr. Gonzalez. I did enjoy our conversation on X, Y, and Z. Now that kind of brings it back to, oh yeah, I do remember having that conversation with this person. Oh yeah, they were actually really nice and kind. Maybe we'll bring them back for a second interview, or maybe this is a potential candidate. Just that one thank you email, compared to maybe the other 50 candidates, if they didn't send anything back, you already stood up. Okay. Resumes, keeping them nice and neat. I could be biased on this, but I don't like resume templates that like you get off a Word and stuff like that.
Right. I'm sorry, because everything you're saying is what I'm teaching. So those that have been in my class, that's why they're not inspired.
So it's with my resume. Well, as we pursue further education, it gets further away from resume and more into CVs, to where you kind of have a whole list of everything that you've done. Anything that would be pertinent to the position, definitely put up there. And it's all about how you word it, right? So if you did customer service at a fast food restaurant, right, you can put that, but how you word it to make it relative to what your position would be is helpful. Because everyone says, oh yeah, I'm looking for someone with 5 years of experience, but I just graduated now, so where am I gonna get the 5 years? You probably got it in different places. It's just how you word it to make it seem that way, okay? But the templates, I'm not a huge fan of, but as long as you keep it organized and neat, it doesn't really matter. It could be as plain and boring as it is. And the most important part is grammar. If something is wrong, I will just toss it out to the side. As soon as you spell something wrong or it's incomplete or like incorrect sentences, because like I said, first impressions, you're literally presenting yourself on paper. If you didn't take the time to review it to make sure it's grammatically correct, what makes you think you're going to take the time to actually take someone's blood pressure correctly or blood sugar correctly? And it's an extreme assumption, right? But at the end of the day, it's true. It's what's actually out there. Going back, how do you present yourself to a patient? Definitely professionalism is big. But also, you don't have to be robotic, right? It's not just saying the same thing. Have some personality, be personable with the patient, have empathy, have sympathy. There's ways to show professionalism and still be able to interact with the patient.
I have a question. What happens when you have an irate patient? They're just like extremely upset. What advice would you give the medical assistants or the building code specialists on how to handle
like irate patients?
Yeah.
The easiest way for me, and I mean it might be hard for some people, I kill them with kindness. So like the saying that the customer or the patient's always right is pretty good to go by. Just kind of agreeing with them and kind of, yes, even though you might be like most times if a patient's irate, we're usually at fault, right? It's never a reason why the patient should be randomly irate or anything like that. So just sympathizing with them, empathizing with them, and just finding a solution. I think the biggest thing is where you try to help someone out without giving them a solution to their problem. That's being in the pharmacy setting, a lot of the times it's, why is my copay so high? Why is this so high? Why is this not covered? Honestly, for me to tell them, well, you have to talk to your insurance, I would leave just as angry as when I came in and then stay on hold for 2 hours with your insurance company. No one wants to do that.
Mm-hmm.
Yeah.
I had a situation like that. I was prescribed medication, and then when I got to the pharmacy, they said that my insurance wouldn't clear it for like 3-4 days later. Mm-hmm. So how would you handle a situation when they're upset about that?
In those situations, it's tough. And it also depends on where you work, right? So if it was something like corporate pharmacy, like CVS or anything like that, some of my hands would be tied just based off corporate policies. Now, if you go to like your mom and pop pharmacy, independently owned, a lot of them will do something to help you. In your situation, if you came to my pharmacy that was just plain independently owned, if you were out of medications and you couldn't get it for 3 to 4 days, I would give you 3 to 4 tablets. And then, okay, now when it's ready, I'll just bill your insurance. Now, that solves your problem. You leave happy, you have your medications, and you're not putting the patient at danger because you're not withholding any medications. Now, if you try that at CVS, obviously there's policies, procedures, and stuff that they might not allow that to happen. But in those cases, I think, and I said this before, if you can understand that healthcare is more determined by your insurance company than your doctor, it makes it easier to understand why these things are in place. Because you might get something prescribed to you, and then you'll hear all the time, yeah, your insurance is covered. But you need authorization from the doctor. And my favorite response is, well, did the doctor just prescribe it? Isn't that enough authorization? Right? So like your insurance company is the one that determines your care more than what your doctor does.
Or the genetic version. How
Yeah.
come we're always given a genetic version?
Yeah. It's
Original
because
version.
whatever is more cost effective to the insurance company. And that's also outside of medications as well. That's with testing, right? So if you wanted to do a certain test, you're like, no, they need to do this test first. And we're like, why? If we already determined that this could be the diagnostic testing they need, why do they need to do X, Y, and Z first? And unfortunately, that's out of the control of even yourself, even the doctor. We could make these appeals, we could do X, Y, and Z, but at the end of the day, what we call step therapy is something that needs to happen. But yourself keeping a cool, calm, collected head in these situations with the patient and trying to provide solutions is something that the patient will most likely leave either a better understanding of the situation, even if you couldn't help them, at least they understand what's happening and why there's a delay in the care. And if you can provide other solutions to the problem, well, there you go. Then you can go with solution A or solution B for what the issue is. And most of the times, the patient just wants options. They just want to know what else they can do if this isn't covered, or what else they can do if they're feeling this way. So that's one of the ways I would probably treat or tailor to an irate patient in this case. Yeah. Also, if you're a medical assistant, or I know in our office, phlebotomists and techs do work closely with the doctors as well. Like bringing back to the example, if there's an abnormal test, they go ahead and present to the doctor. MAs are going to be literally right next to the doctor the whole time. I've developed a good relationship with my medical assistant to the point where, like, yeah, it's professional, but like maybe even like when they're in the charting room, you joke around, you get to know the person and not just the professional. And that's acceptable to a certain extent, right? Obviously, you don't want to go and push boundaries and, hey, doc, want to grab a drink after this? Like, there's certain things that you kind of keep separate from work and life, right? But going to work and life, it might be hard to leave your life at the door, but that is something that is definitely helpful in doing so. Now, practicing what you preach, right? Staying healthy while you're treating patients. I work in multiple settings, whether it's a retail pharmacy, clinic, and I also work at North Beth Israel Medical Center. So at North Beth Israel, the rate of hospital-acquired infections is there. And that's as simple as forgetting to hand sanitize before coming into the room and forgetting the hand sanitizer coming out of the room. So the top two hospital-acquired infections, C. diff, because people don't wash their hands, and pneumonia. Those are the two hospital-acquired infections. Just because of someone not just forgetting to hand sanitize. Right? If you are in the hospital setting or anything like that, sanitation and hygiene is very important. But then now bring it back to the clinic setting, where I think most would mostly be in. Same concept. Before going into a room, try to sanitize. Before coming out of a room, try to sanitize. Now we're in an era of COVID, right? Now COVID was like 2020. We're 4 years into it. Whatever people say, it's still around, whether you believe it or not. But at the end of the day, it's still something you can get sick from, whether it is COVID or the flu or something else. It's all preventable with hygiene, and that's what we want to practice. I always bring this example, and I don't want to be rude to anybody, but usually when we ask patients who might need assistance with diet or nutrition, they always tell me, well, like, my nutritionist doesn't look like she follows a diet, or they follow a diet, right? At the end of the day, it's like, yeah, that's rude, but I go ahead and practice with the people. If I were to go ahead and come in smelling like cigarettes and telling you to stop smoking, like, that's hypocritical. Right. To a certain extent, I will say with diabetes, I do indulge in rice and stuff like that. But I'm telling people not to do it, so I kind of slap myself on the wrist a little bit with that issue. But you do want to present yourself healthy. You want to make sure that you are staying sanitized, like be hygiene, because not only can you get just airborne infections, especially if you're dealing with bloodborne infections is a whole different game. Right? We don't want to go ahead and try to touch people's blood. If you have a spill, there's certain kits for that and following protocol and everything like that. Because when bloodborne infections are there, it leads to like hepatitis or worse, right? Airborne infections can give you flu, can give you COVID. RSV is now a talked about thing, but it's been around for many, many years. But these are things that are all preventable with just hygiene and staying healthy. If you are sick, stay home, right? Because you are dealing with sick patients. And depending on where you are, some patients who might have transplants are now immunosuppressed, meaning that they are more susceptible to getting severely ill with a common cold. Right? So these are things that if you are feeling sick, depending on where you work, it could be a little difficult getting time off or having sick days off, but just know in the back of your head that you're putting the patient first in a situation like this. Yeah.
Cause you know how attendance is important at any place you're at. So what if I'm ill? I usually have like the probationary period. Now, what if I'm sick? Like, are you gonna look at me? Cause some people, it be the little people that mess it up for everybody. So some people are sick just to get out of work and have fun. But if I'm really sick, like, are you gonna y'all get upset, especially if it's like in the probationary period?
It depends on like how you present it. Right, like, so if you were someone who, and I guess it might be wrong in saying this, but if you show up at work with the sniffles and I know that you're not feeling the best and you're at least showing an attempt, most of the times we'll just usually send people home. It's like, okay, you're sick, or here, get tested. We have, in our office at least, we have COVID tests, rapid flu tests, RSV tests. So if you test positive for any of them, it's like, okay, well, you're actually sick, go home. Now, in the time of probationary periods, you might need to go a little above and beyond in that, okay, I'm gonna go to an urgent care and get a sick note. So then that way you have documentation that you weren't just home scrolling on Instagram or something. You were actually out getting yourself treated and trying to make yourself feel better. In those cases, I had my staff members call out in those probationary periods. If they tell me you're sick, all right, you tell me you're sick, that's fine. And they show me proof that they're sick, that's great. Now, outside of that, you are entitled to sick days. If you're sick, use them. I mean, that's you're taking care of yourself, and you're also taking care of your staff members. You're taking care of the patients. For those instances where someone might be on immunosuppressive drugs and they might get sick because you were around. And some of these, like we were talking about the topic of COVID, those new variants are now easily spreadable. They might not be as severe as the older one, but you can get infected quicker than what you did before. So definitely hygiene is important. Depending on what setting you're in, if you're in a hospital setting, it's mandatory, it's policy. You hand sanitize before you go in the room, hand sanitize before you go out of the room. And I honestly think that's a good mindset to have even in the clinic itself, because you don't know who you're going into.
I think I have to build my immune system because I get colds either way.
Yeah.
And I use a lot of hand sanitizer and wash my hands a lot.
Okay. So there's immune boosters like vitamin C, zinc, and all that other stuff. That's definitely something to boost your immune system. So it wouldn't hurt, especially if you know you're going to be in a setting where you're around sick people, right? And it's kind of like the misconception. Yes, we have sick visits, but then most of these people just have chronic diseases that they're just following up and getting checked out. So it's not. I'll tell you that I don't actively see sick people, just not because I don't, but just because they're mostly just coming in for checkups and just following up on their blood work and following up on results and things like that. So yeah. But any questions or anything like that? No? So yeah. go ahead.
How often do you, I heard you said that you work at numerous places. How often do you float around? Is it just one specific place that you're at, or is this on a regular basis?
So there's multiple answers to that question. Since I have like multiple different positions, if you're in like the pharmacy world, you could float depending on where you are. Like I don't work for a big corporation like CVS or Walgreens, so most of my connections would be just because I know some pharmacist that needs help. So like maybe this weekend I'll get a call if I wanted some hours, I'll go ahead and pick up some hours. Now in the clinic at Nirvana Healthcare, we currently have 6 offices, of which 5 are internal medicine, one's behavioral health. We actually have a vein department. Of those 5 internal medicine clinics, I float through 3 of them. So I'm in East Orange 2 days of the week, and I'm in North 1 day of the week. What I usually do is I get referrals for patients with diabetes with an A1C of above 7%, or any chronic kidney disease patients with an eGFR less than 60, or congestive heart failure patients with the ejection fraction less than 50%. So these are more early onset than anything, because we're in the field where this is preventative medicine, right? Once you're in the hospital, you're more treating. We're here for prevention, and that's kind of hard concept for a lot of patients to get, because I have patients who are like, oh, I'm not taking my cholesterol medication because I don't have high cholesterol. It's like, well, how do you know you don't have high cholesterol? Well, because I don't get headaches. I'm like, okay, well, like there's so many things that cause headaches and everything like that, but getting the grasp of preventative medicine so you don't get worse is something that's not very well welcomed with patients. They want to get something, they want to take something that they know works now. So with diabetes medications, a lot of the better ones are more to prevent your sugar from getting high, but it's not something that will bring your sugar down right away. So then when I take my metformin and my sugar's still 300, I was like, that's normal, because that doesn't work that way. And then they'll stop taking it because they're not like, no, I want something to get my sugar down now. Similar concept, we're here for preventative medicine. This is why we do preventative testing. This is why we get blood work every 3 months. So when you send a patient to do an EKG once a year and they want to refuse it because they're like, my heart is fine, well, a lot changes in the year. And it's more of like the education behind that test and linking it back to the diagnosis they have. So one of the testing we do is EMGs, which is a neuroconduction test. Usually with patients with uncontrolled diabetes, they get nerve damage. And this is what we're testing to see, is if it's actually showing nerve damage. A lot of patients refuse it because they're like, no, I'm fine, I don't have nerve pain. Well, when you're experiencing the pain, you're already far down that scale. If we could have prevented it months in advance, why wouldn't you want to do that? And then it kind of clicks like, okay, yeah, I don't want to be in pain. If I can prevent it, then that's something that we could do. So being in this field of preventative medicine, I usually do that, back to your question, 3 days a week in clinic. And then at the hospital, I'm more of like the hospitalist. So I'll just be in the pharmacy verifying medications and making sure that the doctor's prescribing the right thing for the right patient at the right dosing.